Okay, good morning, everyone, and welcome to Managing Resistance. This is a community dementia education program of Alzheimer's San Diego. We're very glad that you're here. My name is Amy. I am the Director of Education here with Alzheimer's San Diego, joined by my colleague in the education program, our Senior Dementia Educator, Jean. Good morning, Jean.
Hi, good morning, everyone.
So Jean and I will do most of the presenting of the material here today, but we are also joined by a key member of our team here at Alzheimer's San Diego. This is Rebecca. Good morning, Rebecca.
Good morning. Hi, everybody.
Rebecca is a licensed clinical social worker, a member of our clinical services team, and she's going to be providing support during the webinar here today, both helping out with Q&A, as well as coming on and joining us a few times for some chatting and some activities as we go along. So we're very grateful to have your support. So here is our agenda for this program. We're going to start by talking about the causes of resistance, a very challenging behavior we know in people who are living with dementia. I'm going to start by giving just a quick kind of run through the biology of the brain and why resistance happens. This is not a full lecture on Alzheimer's disease or other types of dementia. We have many educational resources available for that if you want or need to learn more about the disease itself, getting a diagnosis, medications, those types of things. There is plentiful support available for that. Just reach out, let us know. We'll get you connected to that. Today, we're going to be talking primarily about why dementia causes so many people to be resistant, what we mean by that, why it's happening, and then get into some techniques for working with it, for coping with it. We'll give you some communication techniques, and we'll also talk through some real practical kind of tangible care scenarios that we have found in our experience are where care partners and people living with dementia tend to kind of butt heads a lot. We'll talk about some tips and some strategies for that. I'm going to show you a short video produced by our colleagues at UCLA that gives a little demonstration of some of the techniques we're talking about here today. And then, of course, make sure you know how and where to reach out for additional support. So let's get started talking about the causes of resistance in people who are living with dementia. So caring for a person who is living with dementia, caring about, however you phrase this, however you think about it. I like to use this analogy of a little bit, I'm a San Diegan, and I like to think about the ocean and be around the ocean as often as I can. Caring for a person with dementia is sometimes a little bit like this. So imagine yourself out there in that water. You're maybe up to about your knees or so, maybe just over your knees in that Pacific Ocean water. Let's pretend it's a little warmer today than it really is. There's a lot of joy. There's a lot of beauty, honestly, in loving and caring about a person who's living with dementia. There's also a lot of hazards, right? There is a lot going on there underneath the surface. If you're not careful, you're standing out there in those waves, right? It can be exceptionally challenging when, a big wave, an undertow, a sea creature, right? A piece of kelp comes and wraps itself around your ankle, whatever the thing might be. Caring for a person with dementia is a little bit like this. It has its beauties. It has its joys. It has its moments of connection, but there is also a lot going on underneath the surface. And if you're not paying attention, right, you turn your back for a moment, you can really get the wind knocked out of you. It can be a dangerous situation, honestly. So why exactly is it so challenging? If any of that resonates for you and you're like, yeah, it really is so hard. You're not alone, right? Caring for a person with dementia is challenging because their needs are constantly changing, like those ocean waves, right? You think you've sort of got it figured out for today. You found a strategy. You found a technique that's working for you, and tomorrow it doesn't work. And then the next day it works again, right? You have to constantly reassess, where are we today? How is this person doing in this moment? It can be a very physically demanding role, even if you're not a live-in 24/7 caregiver, but especially if you are. People with dementia frequently have sleep disturbance. The symptoms are highly variable. It can be a very physically demanding role for a care partner. Sleep disruption is very common. And if one person in a household has disrupted sleep, very often everyone in that household has disrupted sleep. So trying to constantly navigate this where are we today? What are this person's needs in this moment? Doing all of that while physically exhausted, not getting enough sleep, probably becoming a bit socially isolated as a result of one's caregiving responsibilities. It's hard for people who haven't lived this experience to really understand and relate to what family care partners are going through. And then, of course, challenging behavior is the major obstacle that most of us are facing, resistance being one of those key behaviors. So why is this happening? In moments of frustration, I have long found that it can be very helpful in terms of mustering some patience, mustering some kindness and some forgiveness in those moments when a person with dementia is being highly resistant to your attempts to be helpful. When they're just saying and doing things that are really out of character for them, that are really throwing you off your game, right? To remember, this is a person who is living with an organic brain disease, whatever the nature of their dementia is, if it's Alzheimer's disease or some other type of dementia, or maybe you don't know, right? There is brain cell loss, there is brain cell death happening. This image can be hard for people to see, people living with dementia and care partners alike. I know that, but I think the image itself, I ask you to sort of carry it with you in those hard moments, because for the most part, people with dementia don't look outwardly any different than they used to, right? Some things have changed physically in terms of maybe how they care for themselves, in terms of personal grooming or how they dress. But for the most part, people look and often act very similarly to how they did before they had dementia. And then there are these moments that, again, they sort of take your breath away, they catch you off guard. So I ask that in those moments, you remember this image. There is deterioration, there is disease happening in that brain. And this is beyond this person's control, as much as it may in some moments feel like they're doing these things to push your buttons and to be difficult. They're usually not. So let's just take a very quick walk through the key regions of the brain that are damaged by Alzheimer's disease and other types of dementia, and what happens when we see that progression. So Alzheimer's disease and many other types of dementia as well start in the temporal regions of the brain, which are sort of smack in the middle of the brain, right behind our in the center behind our ears, about an inch or so behind our ears. The temporal lobe of the brain contains the lobes of our brain that are responsible primarily for short-term memory creation and storage, and a lot of our verbal language abilities. So if you are attempting to offer medication to somebody who is living with brain changes related to dementia, they may refuse an essential medication. I don't need to take that. I don't know why I take that. I don't know why you're trying to give that to me. They may think they've already taken it, right? Because of short-term rapid forgetting, or again, just may not know why exactly it was prescribed. So Alzheimer's disease tends to start in the middle of the brain there, and then it will sort of move up, it will spread around. It doesn't move, it spreads into different regions. And as the different regions are affected by the disease process, whatever that disease might be, we're going to see different types of symptoms emerge. So when there's damage in the parietal lobes up on the crowns of our head, this is where a person is going to have changes to how they perceive sensory information. And we will often see a lack of manual dexterity, just generally being more clumsy, having a harder time with handwriting, opening, bottles, jars, doing sort of normal motor skill functions, normal for them. So people who have damage in this region of their brain are perceiving sensory information differently. So it isn't, that they can't hear necessarily. They may also have hearing loss, but they also may have vision impairment. They might have a blunted sense of smell, for example. But what's ultimately happening there, the sense organs are taking in all of the information, but the brain is not processing it the same way. So you might find someone getting dressed on a very warm summer day and putting on lots of layers of clothes, not accurately perceiving how warm of a day it is, right? Not being able to kind of think through the consequences of, if I'm wearing, 3 flannels and a vest and a sweater and it's 85 degrees out, I'm going to be very hot, right? So damage in the parietal lobe just makes a person interpret the sensory perception a bit differently. When there is damage in the occipital lobes toward the back of the brain, we might see changes to a person's balance, to their gait. We might see the development of a shuffle, sort of a change in their center of gravity. And notably, a lot of that is because of changes to the person's field of vision. So the peripheral field of vision for people who have brain changes related to dementia that is affecting the occipital lobe and the parietal lobe together, we're going to see a significant narrowing of the person's field of vision. And so this changes a lot about, if you were sitting wherever you're sitting right now, trying to watch this webinar through a pair of goggles, right? Or that were restricting your peripheral vision, or binoculars for that matter. You're going to see everything very differently. Your depth perception, your ability to interpret, social context, taking in the big picture of everything that's happening in a room, not just the thing that's happening directly in front of you. All of that is changing for people with dementia. This is very helpful for us to keep in mind as we're going through our day-to-day interactions with people, remembering that they are literally seeing their environment differently than you're seeing it. So this is often the cause of a lot of misunderstandings and a lot of the resistance that we see. So the frontal lobe of the brain, this big region at the front of our brain, is maybe the most important in terms of thinking about resistance as a challenging behavior in people who are living with dementia. This is really the seat of our emotions, or more accurately, our ability to regulate our emotions. Our frontal lobes are doing much of the very complex thinking, problem solving, insight, judgment, reasoning. I've heard it described as sort of the brain's governor, right? If you're having a really good day, this is the part of your brain that allows you to kind of read the room and say, everybody else seems to be a little bit somber. Maybe I need to ratchet this down a little bit. Or if you're having a really bad day, but you need to sort of participate in normal social interactions. This is the part of your brain that gives you empathy, perceptive empathy, the ability to see another person's side of a situation, but also to kind of read social cues and know, I might be feeling this certain way. I might be having this particular thought, but I probably shouldn't act on it. I probably shouldn't say it or do it because it's going to make other people uncomfortable, or it's not going to be helpful in this situation. So when there's damage in this part of the brain, this is where we see a lot of personality changes. And it's kind of the heart, the seat of where a lot of these behavioral challenges come from. So what are the most common personality changes that we see in people who are living with dementia? That decision-making, judgment. So I'm just talking about a change from kind of what was baseline, what was normal for them. Not everybody's going to change in the same way. So if somebody was, before they had dementia, a thoughtful kind of a plotter of a decision maker, right? They took in lots of information and made decisions slowly and thoughtfully. As the disease progresses, what we might see is them starting to make very impulsive decisions, not thinking things through, just sort of jumping in both feet first, right? Or conversely, if somebody was always a very take charge, get it done, make a decision quickly, and they become very challenged to make decisions and think things through, right? It can change whatever the change is, that's what we refer to, and that's what we're calling a behavioral change, right? It's just a change from what was normal, what was baseline for them. Unfortunately, we do see some people with dementia become combative. Many people will experience anxiety. That's a very common behavioral expression in people with dementia. Just imagine all of those brain changes I just walked you through. Put yourself in their shoes for a little bit and think about how confusing or sort of out of control one's environment might feel at times. So agitation and sometimes combativeness does happen. Difficulty with the initiation and termination of tasks, meaning it can be very hard for someone with dementia to get started on doing something, right? If you ask them to just, it's time to take a shower. Can you go take a shower, right? And they say no, that no is probably wrapped up. There's probably a lot wrapped up in that no, right? It isn't just like, I don't want to, there might be a part of that, but there's often just a difficulty with initiating what exactly do I need to do first, right? So if we can get the person started on the task without, putting a heavy cognitive load on them, figure out where the bathroom is, get the shower set up with all the supplies you need, set the temperature to something that's going to be comfortable for you. Right? Think of all of the work, all of the tasks, all of the little decisions that have to get made to initiate any kind of activity day to day. Think of all the things your brain is doing all day long. If we can sort of help with the initiation and get the person started on the task, often we can sort of cut down on a lot of that resistance. So we'll be talking about some strategies for doing that. It can also be hard for people to stop doing something. Termination is also difficult. So maybe once they've started looking for something, they can really perseverate, we call that, really get stuck on an idea, on a task, doing a repetitive motion or making a repetitive movement around the house, for example, rummaging. Just once a person gets going, it can be very hard for them to know, okay, I've accomplished my goal, or I'm not accomplishing my goal. It's time to stop and do something else. Confabulation is a fancy word for something that all of our brains do, and that is just making things up. This is a very healthy, very normal, essential cognitive function that we all have, right? If I don't have the complete picture of, about a conversation that took place in a room where I wasn't there, based on what I see when those people come back in the room, based on how we're interacting with each other, my brain's going to fill in some blanks and tell me a story about what they were talking about, right? We all do this, and we can't always have all the information we need, and our brain has to do this. But in people that are living with dementia, the confabulation can often be a bit of a pathology because it frequently leads to feelings of paranoia, suspicion. The brain fills in the blanks, but the gaps are much bigger, right? And the amount of information the person has access to because of those short-term memory problems, because of those sensory perception changes, the information they fill in the gaps with can be wildly incorrect, nonsensical, but you can't convince somebody of that. So confabulation and feelings of suspicion and paranoia, very common behavioral changes. And then a key one is just having very limited insight into what's changing about oneself. We call this, the fancy word for this is anosognosia, but you can just think of it as oftentimes a person with dementia doesn't realize they've got a memory issue, or they don't realize they're experiencing these behavioral changes. So when you're attempting to be helpful, right, they don't know why you're doing those things. They think you're the one that's being difficult, right? This may sound familiar to some of you. So all of this sort of leads into this behavior that we refer to as resistance. I'm going to pause here before we move on to the next section and see if there have been any questions on this topic of, the brain changes, resistance, what causes it, before we move on.
I don't currently have any questions entered into the chat.
Okay, no problem. Well, we'll just keep on moving. If you've got questions as they come up, we'll have a little more time a little bit later in the program. Go ahead and type those into the Q&A as they come up for you. And in the meantime, I'm going to turn it over to Jean.
Thank you, Amy. So what we will be talking about next is techniques for effective communication, uh, for communicating with a person who is living with a diagnosis of dementia. And there are some very specific communication techniques that we know work much more effectively, help to make the communication more effective than some of the ways, kind of the old ways of doing things. In other words, how we used to communicate with this person living with dementia. Sometimes we have to just kind of throw those types of and ways and manners of communicating out the door and do some changes in order to make it more effective. And so let's see what we've got here. Let me just try and move my slides ahead here. There we go. So what is resistance? Resistance looks like many different things. And what I would like for us to start with is understanding all the different ways it can present. And Amy talked a little bit about lack of initiative, having trouble kind of starting things, and on the other end of it, perhaps having some problems terminating things, stopping things. Well, some of that is can be described as apathy. And, I think we're all familiar with the term of apathy, just that we're kind of indifferent to things. And we don't have kind of that get up and go in ourselves. And so being asked questions like, would you like to go for a walk? Or it's time for you to take a shower. Why don't you go upstairs and do that now? The answers are kind of like, meh, nah, no, not really. I don't feel like it. Not right now. It's just kind of these answers that are demonstrating apathy. Of course, another type of resistance is arguing, and we've all got some of that under our belts. When we think about why we argue, it's because we are trying, we've got a viewpoint that we're going to stand behind, or we want other people, we want to persuade them or convince them to see our viewpoint. And so we argue with them about that, trying to show them through the argument why they are wrong and why we are right. Now, if we've got fully functioning brains that are not impacted by dementia, oftentimes our arguments serve us in a positive way, because we are able to kind of achieve our goals and sometimes convince other people to see our point of view and to agree with it. So arguing does serve a purpose. Now, for a person living with dementia, there's going to be some challenges with that, because they don't have that executive function to be able to think critically and be able to assess fully and use good judgment. Another way of showing resistance is just refusing assistance. And again, I think that's probably something we've all been guilty of at different times. Can I help you with that? No, I'm good, thanks. Do you need a hand? Nope, I've got this. What can I do for you? No, everything's good. I'm fine. I don't need any assistance here. And, so that's kind of a fairly, I would say, a fairly common, just kind of human response to things. We do like to be independent people, and we like to try and manage things on our own as much as is possible. And that doesn't change with the diagnosis of dementia. We do still see people refusing assistance, even when, as Amy said, there is clearly some need for them to maybe have or require some assistance, but perhaps limited insight into recognizing that within oneself. And then, of course, we have combativeness, and that's kind of like the arguing and refusing assistance that's ramped up several degrees, where we're getting a little bit more angry, I guess, and agitated, and ramping up that arguing and refusing assistance by getting a little bit more no, a much stronger no. And so what does this all mean? Yeah, it's just what I've described. We're saying no. And so I think we need to, so when we hear these no's, or when we see these behaviors that we've just talked about, we need to do a stop for a moment and just recognize that people living with a diagnosis of dementia have not changed in their desire to be autonomous, independent people. And so we need to stop for a moment and just have some respect for those words, those behaviors that are saying no. Doesn't mean we stop trying things or stop communicating, but that we do stop and show some respect for that. So no versus yes. Well, what you will see in this slide is down there, kind of in the center of our brain, right down right down in there in the middle, actually down low, not quite in the center, but down lower. We've got this little part of the brain that is called the amygdala. And the amygdala is very important for all of us because it is the part of the brain that acts quickly to keep us from harm. So this is the part of the brain that is triggered when we see or enter into a frightening situation, or an alarming situation, or a situation where we know right away we have to make some very quick decisions here. And so think about, when you are maybe in a situation where an argument has become confrontational, and you can feel the tension and the energy, shifting up. It's looks like this is going to become more than just an argument. It could get really nasty. And think about what your body is doing while you're kind of perceiving this situation. Your heart rate kind of goes up, your breathing gets a little bit more shallow and a little bit more rapid. Your brain is amping itself up for, what are we going to do? How are we going to handle this situation? And the intent of all that is to keep us from harm. So what it is important to know is we all have this part of the brain, the amygdala, and people living with dementia have it as well too. And it often remains undamaged until later on in the disease process with diseases like dementia. And so we often therefore see people who are living with a diagnosis of dementia operating from a place of defensiveness. And, again, I think if we just stop for a moment and think about it, we can understand that and show some respect for that, because I think we can all put ourselves in those shoes where we are just protecting our own physical selves, our own emotional and mental selves, and also protecting our autonomy again and our independence. And so this is why we tend to see the answers or the resistance or the behaviors being of the no variety more than they are from the yes. And put more simply, When we say yes, we're opening ourselves up to something new, possibly something unsafe, something risky, something that's going to require further engagement from us. When we say no, we're keeping ourselves safe. We are towing the line, we're staying within, the areas and the boundaries that we're comfortable with when we say no. So no tends to be the answer that's easier to give. So, do you want to go bungee jumping with me this afternoon? Probably most of your answers will be no. I don't want to go bungee jumping this afternoon. Would you like to go for a walk with me this afternoon? Well, some of you might answer no, but there might be a few more yeses. But again, just to understand that yes is opening ourselves up to risk, to challenge, to newness. No keeps us on the path we've always known that feels safe and secure. So we say what's happening in their brain. And that's, what we've just talked about, what's going on with the amygdala. So, but the other thing is what is happening in your brain too. When you're having this dialogue with a person living with dementia and they're saying no, and they're arguing with you and showing resistance. Well, while all this is going on, focus for a moment on what is happening in your brain. And when you're getting this pushback from people, what's happening with you? Again, your amygdala is having this reaction, and your brain is thinking it's under attack, it's being challenged. And so it's easy, if we think about it for a moment, to see how we can get into these unproductive dialogues, arguments, conversations, whatever we want to call it, with people, and certainly with people living with a diagnosis of dementia, because they're resisting, and their resisting makes us kind of also resist. And so the dialogue and the conversation continues to grow more heated, it gathers more energy, and essentially there's more resistance happening between oneself and the person you're communicating with. So how do we kind of break this cycle and give our brains a moment here for the amygdalas to calm down so that we can actually get on to some productive communication? Well, the first thing to do is to take a deep breath. And you're at that ocean. Amy talked about the waves. There's lots about it that's beautiful. There's challenges there, though, too, and there can be danger lurking. So let's just stop for a moment and take that deep breath. And think to ourselves, I need to respond and not react. Look at that wave is coming in for me. I need to respond to what is happening right now in front of me with that wave, rather than reacting. So when that wave is coming at you, we can try and stand firm. We could show our resistance, right? I'm going to dig my heels into the sand and really set my muscles here. And then we let that wave crash into us. Have you done this at the beach before? Certainly I have. And oftentimes the wave gets the better of you, right? It knocks you over, or maybe it sucks the sand out from underneath you and off you go, you tip over. So trying to show resistance to the wave is not very productive. So what's the other option? Well, you could let the wave wash over you. And that can happen, and that might not have, you know, the impact of like knocking you off your feet or throwing you around in the water. You feel the wave wash over you, but there might still be some other challenges involved with having it wash over you. You might end up with a big mouthful of water. So what would be maybe the preferred method of responding to the wave rather than reacting? What do? We take a deep breath and we dive in and under. And that gets us through the wave, through the churning water, with the mouth, lungs full of air and oxygen, not water. And so we want to try and apply this analogy to our communications with people living with dementia. So, reacting versus responding. What's the difference between these two R words when we're conversing with people living with a diagnosis of dementia? Well, reacting is correcting, confronting, and arguing. Don't you remember, Mom, I told you we have that appointment at 10 a.m. today and you're not ready and we're running late. So let's, I can't deal with this anymore. We just need to get going. So what I've just said is correcting, it's confronting, it's arguing. There's really nothing about it that's a very positive communication. So what about when we are responding? We are validating, reassuring, and redirecting. And so with reacting, the focus is on you. Think about the example I just gave you. I already told you, Mom, we have this appointment at 10 a.m. We're already running late. And well, I just can't take it anymore. That whole string of words was all about me, what I'm feeling, experiencing, and now expressing. So with responding, the focus is on them. So how about, I'm so sorry, Mom, I must have forgot to tell you about that doctor's appointment today. I'm very sorry about that. I'll make sure I don't do that again, okay? We have the appointment and it's important. So why don't we just go ahead and we'll drive to the doctor's office and afterwards maybe we can go and get an ice cream together. So validating, apologizing for the mistake that you didn't make, which is forgetting to tell them about the appointment. You're reassuring and you're redirecting. Let's go for the drive. Let's go for the ice cream. So the focus turns to them. So what are the communication techniques? This is some tips and ideas for you that is in the brief here. We've got a really terrific class called Communication Skills webinar, and it goes into these techniques in much more detail. And I really encourage everybody to either have a look at it in our webinar library or come on to, the next one we have coming up in this next quarter. Terrific class, and gives you some real specifics with regards to communication. But here's the short and sweet of it. Calm and reassuring tones. Short, clear directions and questions. Giving plenty of time for the person to process what you've just said or asked. And giving them plenty of time then to respond. Repeat as needed for understanding. And to validate and agree. And to forgive and apologize. These are the positive ways of doing some of these things. And having these conversations. And so here we've got this kind of funny little slide here where the little bubble is got his finger up like this. I think we all know what that means, right? Shh, no more talking. So, and this is interestingly and ironically, one of the most effective ways of communicating with a person with dementia is to just be quiet, talk less, listen more, observe more. We tend to go the other way with people with dementia, living with dementia. We over-explain. We give a lot of detail, too much detail, all sorts of different reasons and explanations and so on and so forth. And sometimes more words is not helpful. Less words sometimes is. Now I'm going to turn it over to Amy, and she is going to start talking about tips for providing help to someone who is resisting your assistance.
Great. Thank you, Jean. Yeah, let's get into some kind of practical applications of these great tips that Jean has been sharing. How do you put them into practice when you are attempting to provide care or support to somebody who's living with dementia? First, I just want to kind of pause us again and ask you to remember that dementia is progressive, right? Over time, the person is losing function. We tend to come at caregiving from a different perspective, usually, because we're used to doing things like raising children who are developing new skills, or helping somebody recover from an illness or an injury and helping them regain their strength and regain those abilities that they've lost. Dementia is something different. While certainly we're not giving up on people and we're allowing them to do as much as they can tolerate, we also have to come at caregiving from the perspective of we're not rehabbing this person. We're not trying to challenge them to do more than they're currently capable of. We want to sort of push right to that point of comfort and tolerance. Dementia causes a progressive loss of function. That is an unfortunate reality at this time. We don't have medication or treatment of a non-pharmacological type yet that can halt or reverse the symptoms of dementia, at least nothing that's been validated in large scale research. So just keep this in mind. Our goal is not to make a person with dementia independent. Our goal is to make them feel in control, autonomy. That we can accomplish. That is a realistic goal. So we want to be reasonable in our expectations of them and also of ourselves, remain flexible. Right? The definition of what passes as a proper shower or a proper bath today might have to be a little looser of a definition than it used to be, right? In the name of getting us through this day, getting us through this moment. One of the best techniques, the best tips that we've heard comes from a dementia care expert named Teepa Snow, who developed a method called the positive approach to care. And one of the strategies she advocates for is to focus on doing things with the person with dementia, not coming in, sort of elbowing them out of the way, doing things for them, doing things to them, but allowing them to feel that this is an activity that we are doing together. So you'll be more successful at helping the person feel that autonomy, feel in control of their situation. If you spend a little bit of time up front preparing the environment, we call this creating a dementia-friendly environment for the person. This means removing some of the clutter, whatever that might mean, right? It could mean physical stuff that is going to cause distraction when you're trying to get the person to go into the bathroom and brush their teeth. Clear all the other things off the counter, right? If that's helpful. Clutter can also be auditory, it can just be, music, it can be sound, it can be other people, right? So decluttering the environment in whatever way makes sense. Gathering those essential items that are needed for this task or this activity. Everything that we're describing here isn't just for things like bathing and grooming and personal care. It also applies to doing fun things, getting ready to go for a walk, right? Have the shoes, the jacket, the hat, all of those things, have all of those prepared items, essential items prepared and ready and within the person's sort of line of sight. Reduce those distractions. Again, sound, activity mirrors can actually be a surprising cause of distraction and confusion for a person with dementia. So if you're doing tasks in a room that has mirrors, maybe consider covering them, repositioning them if possible, to minimize some of that distraction. Having a safe, comfortable, accessible place for the person to sit and do this activity, getting dressed, for example. Maybe we need to move a chair into the bedroom if there isn't a comfortable place for the person to sit down and pull their socks on, for example. This also refers to space for you as a care partner or whoever is going to be coming alongside and doing the task with the person. Thinking about things like lighting, adequate lighting when it comes to supporting a person who's living with dementia doesn't just mean bright lighting, and it doesn't just mean overhead lighting, because that can just create a lot of shadows and a lot of contrast that can be sort of confusing. Having good bright lighting that also comes from the ground up, or from underneath countertops or underneath cupboards to illuminate a counter, for example, so that the person's got a lot of lighting, but not a lot of shadows and movement to distract them. And temperature, surprisingly important, especially when it comes to the issue of bathing. Getting the room set up, warming it up a little bit if this is at all possible. If there's a heated lamp, a space heater, something that you can do to warm up a space where a person is going to have to take off their clothes. So for bathing or for getting dressed, setting the temperature. Most people, as they age, they tend to run a little colder. And so upping the temperature in the room for them a little bit warmer might make you a little bit uncomfortable. This is unfortunate, I know, but this might actually really make the task of bathing, showering, getting dressed, other things that require you to take your clothes off can make that task a lot more successful for them. So when it comes to bathing and showering, I'm just going to sort of run through a couple of scenarios here pretty quickly. I want to reinforce we've got tip sheets and additional resources on these care-related topics that we can send to you if you're interested in that. Rebecca, if I could ask in the chat, if you would put out a link to the follow-up request form. If there's something that's coming up in this webinar that is of interest to you and you want to sort of learn a little more, get a little more information about it, we do have tip sheets on some of these care tasks that we can pass on to you. So fill out that form and a member of our clinical services team will reach out and get that information to you. So bathing and showering, again, gather those supplies that you need in advance. You don't want to, all the good communication techniques that Jean was just talking you through, you don't want to get the person, okay, they're on board, they've gotten up and they're heading into the bathroom to head in for that much resisted shower or bath, and oh gosh, we don't have any towels, we don't have any supplies, hang on, let me go grab all that stuff, right? You're very likely to lose their attention and lose their participation in that moment. So have everything you need gathered ahead of time before you begin your ask, before you begin bringing the person toward the space where this activity is going to happen. Preparing the room with lighting, temperature, depending on what you're doing. Music might be soothing if it's not too distracting. On the topic of doing with and not to or for, using very simple, direct, clear, kind of action-oriented prompts is very helpful. Don't ask the person, do you want to take a shower now? Do you want to take your bath now? The answer, as Jean described, is almost universally going to be no matter what the person thinks or feels about that bath, for reasons that were well described about, just how the brain functions. They're very likely to just put up the hands and say no. Whereas if our language is more action oriented, and this becomes something weird, let's go get cleaned up. Your bath is ready, right? You're using language, you're taking away the no, you're taking away the option for the person to say no. It's not always going to work, I admit that, but it's a very helpful communication strategy. It's just being very clear, very direct. And a final note here, and an important one, when it comes to bathing and showering and getting dressed as well, we need to respect people's privacy, no matter what your relationship is to this person. If this is your spouse of 50 years, and of course you've seen them without their clothes on, hundreds and hundreds of times, thousands of times over the years, that doesn't mean that they're going to be comfortable taking all their clothes off and having you help them in a bath or showering situation. This is a new situation for that person. They haven't required assistance with this in all likelihood for most of their adult lives. So we still want to be mindful of the discomfort that this may be causing for this person, especially if it's not your spouse or your partner. This is a parent-child relationship or a friend or a sibling or a neighbor or a professional caregiving arrangement. We really want to be sure to be protecting that person's dignity. So maybe letting the person, wear their undergarments into the shower, into the bath, right? So they get wet. It'll be uncomfortable, and then they'll take it off, and you can sort of ease them into this using washcloths or towels to cover up private areas and or to keep them warm, right? A towel over the person's shoulder just to keep them a little cozy as you're wetting down the rest. Bathing and showering when it comes to dementia care and people with other types of disabilities as well, it makes a mess, right? You're going to get wet. There's going to be wet towels everywhere. This is just sort of one of the consequences, but it can really, being willing to kind of make that mess and get those towels wet or get the undergarments wet and then take them off once the person is in the shower can go a long way to helping overcome some of that resistance. Some quick tips on getting dressed. First, just think about the clothing itself. If there is something that the person really likes to wear, it's not uncommon for someone with dementia to get kind of stuck wearing the same thing over and over and over again, which is, fine as long as the items are clean and in, good repair. But sometimes they're not, and that's still all the person wants to wear. So maybe consider buying duplicates if possible, or things that are very similar. If you found something that works, they're comfortable in it, it's, safe, and it's the appropriate type of clothing for the weather or for the event, just go with it. Again, letting go of those expectations and being flexible. Buying some multiples of it will save you a lot of, hopefully save you some anguish down the road. But keep clothing, footwear, keep it all as simple, easy to get on and off as possible. Lots of little tight buttons, little zippers, things that the person can't reach very well. Remember how their brain has been changing, their manual dexterity, their ability to follow instructions and do things in sequence. Right? If we've got complex layers of clothing, we're not doing them any favors. So keep it simple. If the person is able to dress themselves independently, it might be helpful to lay out their clothes for them so they don't have to select what to wear. You lay it out, and you lay it out in reverse order. So the things that are going to go on first are on the top of the pile, and they can just work their way through it. As best you can, give them that autonomy, respect their choices, respect their privacy, give them space if it's safe to do so, giving them directions, but also providing cueing, right? If you want to help a person feel autonomous and in control of the task of getting dressed, what they probably don't want you to do is, reach in and stick your hands in their space and help them with their collar and their buttons, right? You're very likely to get resistance to that, right? That you're in their space and they may not understand why you're trying to help them. But what might be helpful is if you too put on a button shirt, right? And show them what it is that you mean, right? Demonstrate for them or just point to what it is on yourself that you want them to look at on themselves. Right? Giving some visual cueing along with verbal cueing can make the verbal cueing make a lot more sense to the person who might be feeling resistant. Meals are a big struggle for a lot of people caring for people living with various types of dementia. Some forms of dementia really significantly change a person's eating habits. People eat more often, eat sort of in a more sort of compulsive kind of a way. And we often see that in many types of dementia, people are really craving sweets. You may have noticed some of that in the person that you're caring for. All of those things are pretty common. We want to do our best to keep the person eating good, nourishing, nutritious food, staying well hydrated during the course of the day. But, again, sometimes we're going to have to kind of ease up in terms of our expectations, as long as it's safe to do so. So some tips when it comes to meals and eating with a person who's resistant, can just think think about the timing of your meals, the way you're scheduling them, and the way that you're coursing them. Is this overwhelming? Is the time of day that you're setting the meal down in front of them, is this not their best time of day anymore, right? A long-standing pattern, ritual, routine definitely should be considered. But if now this person just functions very poorly for the first couple of hours of the day, right? Maybe we need to sort of change up the morning meal to be something much simpler that they can tolerate better, and kind of backload the calories for later in the day when they're better able to function. Again, considering your options and being flexible, changing your expectations about things. The coursing of meals, just keeping in mind all those visual field changes that I was talking about before, as well as difficulty with initiation that I was talking about. So you set a big plate of food down in front of a person who's living with dementia. It can be so overwhelming that they literally don't know where to start. What utensil am I even supposed to use to pick up this particular type of food? Am I recognizing that type of food? Am I doing this in the right order? Where do I start? It's all too much, right? So instead, what we get are the hands, right? No thanks, I'm not hungry. So if you can, kind of simplifying what's on the plate, what's being presented to the person, making it very clear what they're supposed to do, right? Again, giving them verbal instructions if needed, but visual cueing, showing them what it would look like to put the spoon to their mouth can be very helpful. Back to the topic of being flexible and letting go of your expectations, redefine your definition of finger foods, right? Many things can be finger foods if they need to be. Soup, maybe not, but otherwise, for the most part, we can make a little bit of a mess. If it's easier for the person to eat, a sandwich that's cut up into little pieces, salad that's not dressed, that they dip the lettuce into some dressing instead of eating it with a fork the way that they used to, right? Whatever it takes, eating meals in a home or even eating in a restaurant, right? Asking the people in the restaurant to be patient and just don't worry about what's happening at this table right now. My loved one is going to enjoy this meal and it might get a little bit messy. Just redefining what it means to eat finger foods, giving those simple directions, one step at a time, calm, clear, simple directions, and again, providing physical cueing to accompany. Why don't you take a sip of water now, right? You can hold up your own water, take a sip, show them what you mean when you say that. The easiest tip here, and it's so easy to overlook, is eat together. Eating is a social activity, and this is something we very easily forget when we get very caught up in the very busy to-do list of a caregiver or a care partner to somebody who's living with dementia. We prepare the meal. We're maybe not going to be eating the same thing because their tastes are changing, or my tastes have changed, or I'm not hungry, whatever the thing might be. Our schedules are off from each other. But if you prepare that meal and just set it down in front of somebody and then walk away, this just isn't how most of us have been eating meals most of our lives, right? Sometimes we eat alone, but not when there's another person running around the house around us doing, cleaning up around the house. If there's other people in the room, eating is usually a social activity. So sit down with them. This is a good opportunity to take that deep breath that Jean was just talking about, how important it is for them and for you. Sit down with them and try to eat your meals together. If you're not hungry, if you're not eating the same thing, fake it a little bit. Put a bowl of grapes in front of yourself, have a cup of tea, just so that you are engaged. You can show them, oh, let's take another bite now. Right? Eating together does a lot to overcome resistance at mealtime. Similarly with medications, if you can make the taking of medications a thing that we are doing together, not sort of setting down the pill box or the dish of pills or the handful of pills, expecting them to take it and just walking away. This will really help ensures some more success. I'm going to show you a short video that explains a bit of this here in a moment. Give the most important medications first, knowing that We might not get through them all today, consider this time around. Consider the time of day. Again, as with meals, if there's a time that the person tends to be a little easier going, a little more compliant, a little less resistant, then talk with your doctor, your pharmacist about whether or not the dosing can be changed. You know, she just functions a lot better in the morning than in the evening. I know this is a medication that she's supposed to take at night. What can we do? There's usually some changes, some adjustments that can be made. I'll skip through the rest of these recommendations because they're well covered in this video. I'm going to show you a video that was produced by UCLA's Alzheimer's and Dementia Care Program. If I may, I'm going to change my screen here for a second to show you. I'm just going to show you briefly what this UCLA's Alzheimer's and Dementia Care Program library of caregiver videos looks like. Over here, I hope you can see all this, a library of topics on a variety of different sort of behavior, caregiving related topics. Very, very helpful. What they'll do is show you sort of how we typically, how it usually goes. And then a doctor from UCLA gives a little bit of a lecture, and then it shows you a better way to try this, some suggestions for that. So I'm going to go back to, okay, hopefully my video is playing here. I'm going to show you this short video that's specific to the topic of supporting someone in taking medications, and it'll give you a little taste of what this video library is all about. In the follow-up email that we send out to you later today, I'm going to include a link to this website. Very helpful resource to us here at Alzheimer's San Diego.
Grandma hates taking her medicine, even after I tell her what it's for. She asks 10 different times why she's taking it. What should I do? Time to take your medicine, Grandma.
I don't need to take medicine. Who said I have to take that medicine? For what?
What are you talking about, Grandma? You have high blood pressure and diabetes. Dr. Brown said if you don't take your medicine, you're going to get sick.
I don't need pills.
Why do we have to do this every day? Just take your pills. I give up.
Refusal to take medication is a common manifestation of dementia. It can be very frustrating for the family, particularly as this has to be done every day. Stay calm and be patient, keeping in mind that these medications help your loved one stay healthy.
Time to take your medicine, Grandma.
I don't need to take medicine. Who said I have to take medicine? For what?
Remember, Dr. Brown said you have to take medicine for your blood pressure and your diabetes. He even wrote a note. My patient, Aura Jackson, that's you, needs to take her blood pressure and diabetes medicine every day. So let's take your medicine for Dr. Brown.
Okay, I'll take it today, but maybe not tomorrow. Only because Dr. Brown said it's a good idea.
Okay. Well, I have an idea. Let's take the dogs outside for a walk. It's a beautiful day.
Do not allow your annoyance or frustration to become part of the problem. Your loved one may pick up on your emotions and become annoyed with herself or you. Here are a few tips on how to improve the situation. Pick a doctor or an individual that she wants to please and tell her that this person advises her to take these medications. If swallowing pills is the issue, check with your pharmacy to see if the medications are available in liquid form. If not, consider crushing pills into applesauce or pudding to make them more palatable. Give pills one at a time with water. Sit next to your loved one when you try to offer the medications instead of over her. If she continues to refuse, allow her to calm down for several minutes, then try again. Remember to be patient, as this process may take several attempts. In regards to specific medications, prioritize the most important medications to be taken first.
There we go. So, what did you see happen differently in that second video? I'm asking Eugene, but I'm also asking all of you who are in attendance. If you would find your chat box. What did the care partner, the granddaughter in this situation, do differently the second time around that you noticed?
Well, I'm going to say that, and I think it says this in the video at some point, is, she got her annoyance under check.
Yes.
And so she had the calm and the patience the second time round. The first time round, she didn't. And, I always have a little chuckle at the end of the first video where grandma flips the pillbox and the pillbox goes flying. But, I think that is there to illustrate that the grandmother has picked up on her granddaughter's annoyance and irritation. And she's like, I'll show you my annoyance and irritation too.
Totally. I totally agree. I think just from that interview at the beginning and the way the granddaughter even starts the interaction in the first scene, that she's like exhausted because we go through this every day, right? Why do we have to do this every day? She's coming in with that perspective, understandably so, but it clearly makes a difference. Yeah, for sure. In the second video, the granddaughter or the grandmother is still being a little, difficult. Right. Well, I'll do it today, but only because Dr. Brown said so. I'm not going to listen to you. Right. Yeah. That could very well be, that's trying to push some buttons, right? That's how that would feel to me if I was that granddaughter, but she doesn't take the bait, right? She just, okay, sounds good. Sounds good.
I mean,
so I see some great
Yeah.
feedback in the chat here. In the second scenario, the granddaughter enlisted the help of the doctor without, getting the doctor directly involved. Mentioning their name, right? Knowing that this is somebody that in this situation, calling that doctor by name is going to be a positive trigger for the grandmother. Yeah. The second one that I see here is my favorite of the observations. She just sat down, right? Instead of standing over her and sort of putting the medication box in front of grandma's face, she sat down next to her. That's a really nice illustration of we're going to do this thing together rather than me sort of forcing this pill.
Yeah, rather than me coming in and I'm the boss and I'm telling you what you're going to do.
Yep.
None of us responds well to that.
Correct. Yes. I assure you, nobody right now in your life loves having someone in your face telling you what to do, and you're not going to like it someday if you're the recipient of care either. It's just how we're wired. Yeah. Great. Okay. Well, I will keep us moving here. In summary, the highest task is to try to honor what their routines, their preferences, their rituals around this activity, whatever it may be. Getting a little exercise, getting outside to walk the dog and get some fresh air, getting dressed, taking a shower, taking your pills, whatever the thing might be. We want to honor sort of their way of doing this as much as possible, while balancing at the same time the way they've always done it might not work anymore. So we have to make those adjustments. That might mean considering a different time of day, changing the pattern, the frequency with which we do this activity, or again, just being flexible and thinking totally outside the box. Providing that validation and reassurance all along the way, right? You're doing a great job, saying yes, nodding, smiling, whatever it might mean in your particular dynamic, in your particular situation, just providing the person reassurance, thanking them for participating with you. As Jean was describing, the power of just saying, I'm sorry. It's a very effective form of validating a person's experience when they're starting to get frustrated with you. Just simply saying, I'm sorry, I shouldn't have done it that way, right? That was my fault. Right. Even if you don't even know what you did wrong, you can't think of a better way to do it. There's a lot of power in just saying, that was on me. Let's try this again. Right. So, and then remembering that positive action oriented language. It's time for us to take our pills. Let's eat. Let's try it this way. Right. Using those types of phrases instead of sort of telling the person what it is that they need to do. Doing things with the person, not to them and not for them. So back to that deep breath, right? This is all a lot to take in. You may have been already feeling overwhelmed at the start of this webinar. And I think sometimes hearing these types of suggestions, it can, if we're not careful, it can sort of be its own wave kind of crashing over us. I really want you to sort of give in, dive into this, right? Take a deep breath, relax, let these moments of frustration kind of wash over you. In the same way that if you're out in that rough ocean tumble out there, it would never be wise to be out there swimming by yourself in the ocean. We don't want you swimming alone as a care partner either, right? So our next section here, which Jean is going to talk about, will be on the topic of resources for finding additional support. But first, we're going to pause and see if there are some questions that we can answer together.
Yes, we do have a couple questions that have been entered into the chat. So I will start with one question is, what is a reasonable temperature for an older person? Her father is in his mid-90s and is always saying that he's cold, and wondering if it's safe for a space heater to be in the bathroom with the person with dementia.
That's an interesting question. I can't say that I sort of know a guideline for a particular room temperature to try for. I think that's probably a very person specific thing. I'd say just, keep ticking it up if that's reasonable for you, to see where the complaints stop, right? Or consider the use of more towels, more blankets, other things that might kind of warm him up instead of I think our instinct is to say, are you kidding? It's 78 degrees in here. That's plenty warm, right? Because we're hot. Just remembering that isn't how they're perceiving that. Jean, do you know of any sort of standards with regard to a room temperature?
I don't. It's an interesting question. I don't. But now I want to do some research on that.
Yeah.
But another thought I'm just having here, rather than a space heater, which I would be a little bit concerned about just for safety reasons. They can cause burns and such, but also just in a damp environment. What about getting like a towel bar warmer installed that makes the towels nice and warm, so that you could wrap the person up in these nice warmed towels,
or just throwing them in the dryer and using them right out of the dryer, and anything that will sort of warm up the object, the towel, or the room itself. Just even simple things, putting some non-slip surface down on tile that might be cold on the floor. It's going to reduce the risk of falling and slipping, as well as not have to put your feet on that cold tile. I think space heaters are okay if it's something you can go in, plug it in for 5 minutes, warm the space up, and then get it out, right? Before the
Yeah.
room is in use. There's no sort of totally right or wrong way to do that.
Right. I agree that if I was to use a space heater, that's how I would do it. Yeah.
Mhm. Okay, great. Thank you. I have two questions from two different attendees, but similar undertone, that the experience is the person with dementia was always very interested in making sure things got done the right way. And both are noticing that there's an increase in that personality trait, an exacerbation, a heightening of almost a determination for them, the person with dementia, to do it themselves, regardless of if the task is being done right or if the task is in the realm of being risky safety-wise. And both caregivers are having a difficult time finding an angle of which to interject because they're seeing they need to, but the person with dementia, again, experiencing and exhibiting resistance.
I think to try to answer this kind of broadly, I think back to Jean's comments about validating the person's experience, saying something very positive to this person about that character trait, instead of trying to overcome it, would be my first thought. Dad, I really appreciate you. You've always been so totally confident and on top of everything. Thank goodness for that. Where would I be without you? Right. Providing some validation and reassurance that this is a good character trait and I appreciate this about you, before we sort of get to the task of like, but we're not going to do it that way, right? Often we have to just do a lot of quiet, unspoken, nope, he put that ladder out there and that's going to be totally unsafe. We're going to quietly get that ladder out so that nobody is climbing up on the roof to take care of that unsafe task that he thinks we're going to do right now. But if I can first make him see that I appreciate how well he's always taking care of this house and how well he takes care of the details, right? Just providing that kind of reassurance that we need this, we appreciate this about you, would be a good place to start. Anything you add there, Jean?
You've said it perfectly. Just to sit down and literally with pen and paper and say, Dad, you are just such an expert in this area. And I know you've got a really set and good routine to make sure it's done well. Will you tell me what that is?
Yeah, let's make a list together. Can you walk me through it? That's a great suggestion.
And so you're validating. I mean, you're not agreeing that, Dad's going to get up on the roof or whatever. You don't even have to have that conversation. Just have that validation and that encounter and then do what I think you're describing, Amy, is what we sometimes call stealth care management. Like you're proceeding with what your plan was, but you're doing that under the radar, not really talking about it, but you're acknowledging Dad's experience and validating that.
Yeah.
Okay, great. I have another question, says, very interested in loading calories tips. My mom's appetite and weight has dropped. We're trying to keep the pounds on. Physically cueing is very helpful, but mom is kind of exhibiting symptoms of playing, so to speak, with her food.
Such a challenge. Well, first, I mean, you might talk with the doctor or seek a nutrition consult around, maybe some high density foods that she might be interested in. If she has diabetes or, insulin dependent diabetes, or another reason that you'd want to avoid sugar, you'd want to be careful about this. But for a lot of people, there is a real craving for sweets that comes with dementia, just because of some chemical changes that happen in the brain. So if there's a way to add fruit to a meal just to make it a little sweeter, ketchup, people start putting ketchup on weird things, right? If there's ways to do that safely, again, that don't create more health problems for the person, that can be really, really helpful. Making the food sweeter, enticing them with, starting with the ice cream, and then, getting in a bite of the vegetables here and there as we need to. Sweets are very motivating for a lot of people with dementia. And I'm not just talking about dessert, right? But just other things that are kind of sugary and fuel the brain that way. Would say though, my best tip would just be making mealtime a together interactive kind of a thing. We sit down together. I show you the physical cue of what eating looks like. I show you that I'm enjoying my meal. It's going to go a lot farther than just trying to, convince the person to take another bite.
Mm-hmm. Okay, great. And then one last question. Generally, and I would say to this, and I'll put it in the Q&A, link to our communication strategies class. But really the undertone is when the person is convinced that you as the caregiver are out to get them, the caregiver is the reason that maybe the keys were taken away or some task they can't have access to. And the person with dementia communicates in a really hurtful way. How do you validate that? How do you join in saying, you're right, I am a jerk? Or how do you manage that?
Yeah.
Right.
Yeah. Validation has its limits, right? We don't want, if somebody thinks we are trying to poison them, I'm not suggesting that you say, you're right, I am trying to, this isn't what we're trying to accomplish, but what we can acknowledge is what they're feeling about this thing, right? I know you're really pissed at me right now. I can see it, and I'm so sorry about that. And I wish it didn't go this way, right? Saying something, I think sometimes we're just really, taking that deep breath that Jean was talking about. We're really afraid to kind of confront head on. I see how you're feeling. You're angry at me right now. Because we feel like if we talk about it, we're going to make it worse. But in fact, it's just not usually the case. Acknowledging that person's really ticked at you, or that person, it's hard to trust me right now. Right. I get that. And I'm really sorry about that. I'm going to try to earn your trust back. Right. Saying something, just, a mea culpa, even if it isn't necessary, can be really helpful. Is there anything else you'd add there, Jean?
Other than to say, which we're going to talk about right away, is access your resources for additional support. It's hard to not take things personally on a regular, daily, 24/7 hours a day, 7 days a week basis. So you need some time out from that, and some time to renew yourself and take care of yourself, and so that you can go back into the situation as a care partner, and kind of have thicker skin and be able to sidestep some of the hurtful comments. That takes work. That's what we're here for.
Agreed. You need a break. You can't be at this 24/7 by yourself and keep that patience and perspective on this all the time. It's just impossible.
Absolutely.
Okay, that's it for questions.
Okay.
Thank you.
Well, we'll carry on then on that theme of resources for additional support. And so, just as Amy just said, don't swim alone. That's one of the big takeaways from today's program, is we've given you some tips and techniques. We've talked about some different things, such as responding rather than reacting, all sorts of good, constructive ways and means of communicating and managing these challenging situations. And the big one here is don't swim alone. So educate yourself and others that are, a part of the environment, the family, the safety net, whoever else is involved in this situation of caring for somebody living with a diagnosis of dementia. Educate them as well too. And this is to reduce your anxiety, their anxiety, and to improve your skills. These tips and techniques that we've talked about have to be learned and practiced. They're not second nature to us. Getting control of our amygdala is a challenge. It is for most of us. That's how us humans are wired. The amygdala is there for a very good reason, because it's saved us many, many, many times in the past. So getting a control of the amygdala takes time and practice. And that's skill building. And that's what Alzheimer San Diego is here to help you with. So identify those community resources like us and like others. And absolutely, you need to get a break. You need to have some time out, some time away. And if you're struggling with that, you don't know how to do that, you just can't manage it, that's just one more reason to contact us, and we'll help you formulate that plan so that you really can get a break. You want to find your supports that validate you and your experience, that provide you with a safe atmosphere, and help you, supports that help you to cope with daily challenges. So not supports, it's not supportive if you're being judged about your reaction. It's not supportive if you're being criticized by family and friends for how you're managing things. It's not support if, somebody's telling you all the things that you need to do differently. So you need to find the supports that are truly that for you, supports. So there we are, Alzheimer San Diego. And Rebecca, I'll ask you if you would once more to put in the chat the link to the follow-up form. So we've got our dementia experts, of which Rebecca is one of the leaders for that team, our clinical services team. And this team of good people is answering the phones Monday through Friday, 8:30 to 5. And these are the folks you want to talk to about some of these specific questions that you've had here today. We've got our virtual support groups, our online education and training, such as today's webinar, our volunteer tech team, which includes Chris and others. We have social activities and outings for people living with a diagnosis of dementia and their care partners. We do partner with and support local research. We have our own respite program, and it is a volunteer-based program, Respite All's Companions. And give us a call to find out more about that. And maybe that's going to be your first step towards getting a break, getting some respite. We have Vitals, which is volunteers that are staying in touch with people living alone with dementia in the community. So these are all the things we do. It's all at no cost to our community that we serve and the families we work with. And we want you to contact us. That is why we exist, is to help support all of you and get you connected with good resources. So there's, again, all the different ways you can do that. You can go to our website. We've got a great website. It's easy to navigate, lots of great information on it. You can email us, you can call us, as I mentioned, to our clinical services team. And we also have live chat, by the way, available on our website. And as Rebecca just sent out, there's the follow-up form that you can just complete that. And one of our clinical services team members will will reach out to you and follow up with you. So we've got a couple of upcoming programs here in Spanish being delivered by our colleague Nellie on Wednesday, April 20th, is looking at the symptoms of dementia and memory loss. Long distance caregiving on Friday, April 29th at 10 a.m. And we also have a new long distance caregiving support group as well. So those two supports are there for people involved in long distance caregiving. We have a drop-in education hour no agenda for that day. You just come with whatever's on your mind for that day, and we'll talk about things and maybe answer some questions too. Have a look at our website for details on all of this. And lastly, we are going to be sending out a survey when things are wrapped up here in just a few minutes. You'll get it online, and we'll ask you to complete that, giving us your feedback about today's program. That's very important to us, very valuable to us. As was mentioned earlier by Amy, a copy of all the materials for today will be emailed to all of you in just a little later this afternoon. And so look for that. And we have recorded today's program, and that will be available in our library sometime soon. And so we thank you for joining us today. I hope this was helpful. And many thanks, as always, to Rebecca for being our clinical services support. Thank you, lady. Appreciate it.
Welcome.
And to Miss Amy, my colleague and cohort, and who always has great information. Thank you, Amy. And to Chris,
Sure.
our tech team volunteer. We're very appreciative of the support Chris gives to us ongoing. Thank you, Chris.
Welcome.
So that's it, folks, for today. Have a good rest of the day, and remember, don't swim alone. Pick up the phone and get some help going for yourself. Okay? Take care, everybody.
Thank you. Bye-bye.
Bye.